Today, let's talk and treat a frozen shoulder, also referred to as adhesive capsulitis. It happens sometimes overnight. We get a severe pain. It just happens out of nowhere, insidious onset, and it causes pain, so then we don't move our shoulder as much. So that limitation is or has actually occurred because it hurts to move it. So we don't want to reach up overhead because every time we do reach, it causes pain. Then in turn, what happens is we get small pieces of tissue that occur and develop in that joint that are called adhesions, and they limit the joint then from performing that full motion up overhead. This normally happens out of nowhere, and it normally happens to females between the ages of 40 and 60. It can be related to hormonal changes, low estrogen. In addition, it can be also related to a low amount of vitamin D in your system. So a frozen shoulder also can happen due to an injury. So if you have had a fall on an arm, it hurts you, and you are either in a sling for a long time, or you can't move your shoulder because it's too painful, then those adhesions develop and we are no longer able to reach up overhead. So self-care at home, you can use heat, which helps to increase the circulation and reduce the pain and gain better movement just by warming up that area. And you can also use over-the-counter pain medication. So today I'm also going to show you some physical therapy exercises that you can do at home. But physical therapy is very beneficial in that we can lay you down and stretch that arm. And honestly, I've broke some adhesions in some shoulders over the years. When you hear those adhesions break, it's a little scary, but you have to push through that, because otherwise, if you don't gain that range back, the doctor will schedule you for a surgical procedure, and all that they do is knock you out, and they stabilize your shoulder blade. They take that arm up, pop, 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 arm to the side, pop, 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 internal, external rotation, and then you come out and then you're back in physical therapy. Also, chiropractic care can be very beneficial in realigning your body, making sure you're in good posture so that there's no rib pinching on a nerve that's causing any pain, to make sure there's no shoulder subluxation in there. So it's very beneficial. A few exercises that I want to show you today are, number one, we're going to do wand exercises. So with a wand, you're just going to take, it can be an old broom handle, and you're going to do some exercises out in front of you. So just grabbing the bar, we can lift out in front of us and up overhead. So that full range of motion. Now, when you have a limitation, it's going to look similar to this. So you go to lift up, and then the one arm can lift, but you're using that other arm to assist lifting up there. So we use the power. So there, I have power in my right, but my left one doesn't go up as far. So you can also lie on your back, and if you do have a little bit of a weight, this is a weighted bar for me, so this is 6 pounds. This would be good if I'm lying down to let gravity help get that bar down. So lying down on the mat here, I can take that bar and I can use it to help get that left side. And if I'm trying to get that range of motion, I'm going to hold it here. And if you have a frozen shoulder, your arm will start shaking. You will have pain, but using that weight and that other arm helps to assist get that range of motion. In addition, we have different directions. So that was for our shoulder flexion. For shoulder abduction out to the side, we would take, so we'll pretend my left shoulder is the issue. So my palm will be away on that side, and I'm going to move it up that bar. And on my right side, I'm going to have my palm towards me, and I'm going to use this right side to push that left side up and out and really stretch it to get it all the way up. Also, we have internal rotation and we have external rotation. So where we keep that elbow tucked in, we bring that arm across the front and then push it out to the side. Anytime doing these exercises, if you're holding for a bit, we could hold for 10 seconds and then we could do 10 repetitions. Or trying to lift that arm up, if you're just going to lift and lower, we would want to try to build up to that 30 repetitions. So the next group of exercises would be wall walking. And that would be taking my arm on the inside of the door and walking up as far as I can. And then I can use my opposite arm to help push it up. And then I can assist sliding it back down. So you can either slide up and down, where you could use a little washcloth, or you can do that climb. So that's for shoulder flexion. For shoulder abduction, it would be turn to the side and you climb to the side, and you can assist pushing up and even leaning into the wall, getting closer and leaning to try to get that abduction out to the side. Our last exercise for today would be setting up some type of pulley system, and you can almost take a band or a rope and attach it through your door, open the door and be able to attach it with something through that door. I have mine attached to my squat rack here. And what we would do is use our, if it's my left side that is affected, I would use my right one to pull and get that arm up. And you have to really work to keep that shoulder down so it's coming up out of that joint. Then I can let go and I can really use it to pull, and then I can bring it back down. And then again, I can use that right side to pull to get that range of motion in my left and bring it back down. This exercise is very helpful getting that shoulder flexion. Same thing, you could turn sideways and use that arm to pull, going up and out to the side and back down. It can take 1 to 3 years to get better. So you really have to work hard at it. It is a very persistent exercise program that takes care of that shoulder range of motion. And of course, we need that shoulder range of motion to get up into our cupboards, to reach into our refrigerator or into our freezer. Hopefully this has provided you with a little bit of information to fight that frozen shoulder.